I'm pretty sure we're not supposed to do that in hospitals. Definitely not the doctors. You can see his brain actually actively exploding. He shouldn't have done that procedure to begin with, but therein lies part of the issue. Elliot has got some balls on her. I love it. Hey guys, welcome back. I'm Jess the MD. Thanks so much for joining me. Today, we are going to be watching another episode of Scrubs, reacting to it, having fun, hopefully laughing. All right, and with that, let's get right into it.
Dude, I am so sure Carl's gonna say yes if she doesn't out power walk naked through these halls singing Me and Bobby McGee.
Janis Joplin. God, she was an uggo. Anyway, I see you're on the nephrology service with Dr. Townsend this month.
Dr. Townsend is like the anti-Kelso. The nurses love him.
Fatty, that color is great on you.
The attendings love him.
Hey, how's the best doctor in this hospital?
Tell me, hotshot. Everyone loves him. Everyone.
Thank you for being you.
And the weirdest thing of all is that he and Dr. Kelso are best friends.
There he is.
There's a nephrologist that I worked with in residency that was just like this. Everybody, absolutely everybody loves him. He's the most wonderful human being ever. And he will literally answer any of your questions.
What's the deal? Did she give you an answer?
Oh, freedom's just another word for nothing left to do.
Not yet.
Thanks, Todd. Here's that $50 I promised you.
Keep it, man. That was for me.
Todd, get dressed.
I'm going back out there.
I'm pretty sure we're not supposed to do that in hospitals. Definitely not the doctors.
Turk's brother is staying with us for the weekend.
Little brother!
It'll be fun.
Jordan is here for her ultrasound today, and I'm going to be holding her claw the entire time. So what you've just done is essentially volunteered to do all of your work and all of mine. And if you'll step right this way, I'll be more than glad to tell you more about what you've won.
See you at lunch, Bobby. Split pea soup today.
We're clearly seeing here that residents are on different services, right? JD is rotating with the nephrologist. The reason that we rotate through most of the different subspecialties is so that A, we can learn about those subspecialties and get a deeper understanding of, say, nephrology, which is the medicine related to the kidneys, or cardiology, for example, which is the medicine related to the heart, neurology being the medicine related to the brain and nervous system, and so on and so forth. So we are exposed to all of those subspecialties to learn about them and to decide if maybe that's a subspecialty that we want to go into. Usually that'll be a decision you do make in residency, but you can make that kind of decision as early as medical school. It looks like Elliot is on just the hospital medicine service or internal medicine service, and JD is on the nephrology service right now.
So, are we finding out the sex of the baby today?
Yes, we are.
No, we're not.
Jordan, be reasonable. If you're incubating some kind of man-bat in there, we should find out about it as soon as possible. There are vaccinations to consider.
Tell you what, we'll compromise. I'll decide this, and you get to decide, sorry, I got nothing.
Oh.
Look, it's common for each parent to feel differently.
Actually, I'm not the father. He's bellboy in Greece.
Neat. It's kicking me.
Who could blame the poor thing?
Okay, for how small of a person Jordan is, she looks a lot further along than about 20 weeks, which is when we would be doing an anatomy scan. Maybe they're doing a scan at like the 36-week mark, just before she delivers. By that point, the sex of the baby would be very, very clearly evident. But the way that OBGYN asked the question, it seems like it's probably the 20-week anatomy scan, so I'm a little bit confused.
Huh. That's odd.
What the hell just happened?
I moved your ladder.
I don't know why you keep doing these things to me.
I don't know either.
Well, if it isn't my favorite custodial engineer. Listen, do me a favor, will you? Help me look after this kid. One of the good guys.
You can see Janitor's internal struggle with how much he hates JD and loves Dr. Townsend, and you can see his brain actually actively exploding.
Sir, can I call you Townsy?
No.
I was having a great time working with Townsy.
Now, Mr. Singer here needs a swan, so why don't you go ahead and do an IJ cut down?
A cut down? No one does those anymore. Sir, shouldn't I just do a modified cell dinger? I mean, it's so much safer.
Come on, let's do old school.
But, sir, I don't...
Grab a scalpel, I'll get the kid.
So I know that both of these techniques are IV insertion techniques, but I don't know exactly the difference, so to the internet. So both of these procedures are meant to insert very large bore IVs. For example, if this patient needs dialysis or something like that, that would be the point of a procedure like this. However, the IJ cut down that Dr. Townsend wants to do is an open procedure where you open up the skin, you expose the vein, and insert an IV that way, versus the modified Seldinger is a closed percutaneous, meaning you just kind of make a little tiny hole in the skin and put an IV in that way. It's a lot safer, it's a lot less risk of infection, but older school doctors that haven't really done any new training will do the older techniques that they know. So that seems like that's what's happening here.
Okay, come on now, Jess. Cut through. Good. Now, open up the vein, but be careful not to nick the carotid artery.
Oh.
Oh, boy.
Oh, no. The vascular surgeon on call said to say you could pick up your patient this evening. He also said to say he could give you a loaner patient if you needed someone to butcher until then, but I didn't really get it.
No one expects you to, son.
Okay, thanks.
All right, this sucks. But as bad as I feel, I'm sure Dr. Townsend feels even worse for making me do the procedure.
Don't worry about it. I'll take the blame, okay?
He hides it well.
JD on one hand is feeling like he shouldn't have done that procedure to begin with. He can't say that openly to his attending because it's really hard to question an attending, especially an attending that is so seasoned, has been around for so long. But therein lies part of the issue. He's been around for so long and he hasn't really learned any new techniques or changed his ways.
Barbie, look, I need you to go down to the lab and get Mrs. Miller's blood work. I also need you to disimpact Mr. Burnett in 317. And what did you say the sex of the child was?
I've got a better idea. You do those things, and when you're done, I'll think about telling you the sex.
Oh, that's weird. It seems like you just went to a swap meet and got yourself a big boy spine. Now listen, you tell her else.
Or else what? You'll treat me worse than you usually do? Here's the inside scoop, Perry. For the first time, I have leverage. You're familiar with leverage, right? It's what you're going to need when you disimpact Mr. Burnett, who, by the way, is so locked up, I'm guessing he's been eating either gum, rubber cement, or cork.
Look, Barbie.
Yeah, that's not my name.
Fine. Dr. Reed. Really?
What?
Nothing.
Elliot has got some balls on her. I love it. But also she probably shouldn't be talking to her attending like that, but also her attending is being kind of mean to her. And she could totally be reporting him to the ACGME. It's a little bit of a rough situation, but it's okay. We'll just keep going.
Excuse me, sir, do you have a second?
Sport, what did I tell you about my open door policy? I don't have one.
Dr. Kelso, I was the one who nicked the artery on Mr. Singer.
Oh, Jesus Christ, son. I just said it was me.
You need to shape up some. Lord knows you're never going to get by on your looks.
All right, first of all, at the very least, I'm interesting looking, all right? And secondly, I feel I made that mistake because Dr. Townsend forced me to perform a procedure that is unsafe and outdated. Sorry, Townsy.
Now, let me get this straight. You screwed up doing something you should have been able to handle, and now you're in here to tattle on the very guy who's taking the bullet for you. Is that right?
This is a rough situation because it's not only we're talking about the medical legal side of things of performing outdated procedures that maybe shouldn't have been performed. We're also talking about the social aspect of it of someone went to bat for you and you're kind of screwing them over a little bit. This is really tough. I understand what JD is trying to do, and ultimately he's doing the right thing in trying to keep any future patients safe in a situation where a procedure is being performed that probably shouldn't be performed or shouldn't be performed in that way. There may be a slightly different way to go about it, and maybe talking to Dr. Kelso in private probably would have been a better option than doing it in front of Dr. Townsend. I think making sure to make it clear that your intention is not to get anyone in trouble, that all it is for patient safety, that should color the entire situation just a little bit differently.
I can't believe that you're giving me attitude. I've taken care of you your entire life, and I come in and I tell you that I'm getting divorced, and you make it all about you.
Well, you didn't seem too broken up about it, Kevin. Why should I care?
She left me, okay?
Divorce in any situation can be extremely difficult. And so I get Turk's brother expecting that Turk would have asked more questions, would have been more supportive. And yeah, now looking at it, yeah, Turk definitely did make it all about himself. I see it from both sides.
I think Mr. Singer's going to be just fine.
Oh, jeez, don't creep up on me like that. I almost dropped some fruit in my loom.
I'm sorry, buddy. Say, listen, nowadays it has become kind of hospital protocol to do modified Seldinger in a case like this. You do know how to do one of those, don't you?
Of course.
Good. Because the patient in bed number 2 needs one. You mind doing it for me?
What the hell's this all about?
Nothing. I was just looking over your files and, well, your osteoporotic patients aren't on bisphosphonates. Your diabetics aren't on ACE inhibitors. No, a lot of your treatments are pretty out of date.
Come on, Bob. Guys like us, we're set in our ways.
Well, this is not an age thing, Doug. Hell, these days, if you've been out of med school 5 years, half of what you learned is obsolete.
Look, Bob, I don't have the energy for all that stuff.
Well, then we got a problem.
And here we are, the meat and potatoes of this episode. Okay, recognizing when it's time to retire is quite difficult. And that comment of him just being too tired and not having enough energy to keep up with all that stuff is probably his sign that it's time. Doctors and all healthcare providers, we have to do continuing medical education or continuing nursing education or continuing insert letter here education to keep up with the latest research, with the latest treatments, so that we can make sure that we are keeping our patients as safe as possible. There's always new research coming out and we have to keep up with it so that we make sure that we're treating our patients appropriately. Because what was accepted as a standard 10 years ago, there may be new research that has shown that there is a better way to go about it. And the way that we do that research is we actually test against the gold standard. So against the standard of care treatment, that's what we're testing against. And we're looking for better outcomes. If something proves that there's a better outcome time and time again, then we change the guidelines to make that the standard of care. And that's how science and medicine evolve.
Sport, if you're still standing there when I turn around, I'm going to have them erase your name, too.
Good night, sir.
It's not always easy to do the right thing. Of course, there's always ramifications.
My car. You think it's my fault he got fired, don't you?
Why would you say that?
No reason.
Oof, JD and Dr. Kelso, they did the right thing, but it really is hard to make that decision, especially when Dr. Kelso and Dr. Townsend are so close. It's an impossibly hard decision to say,
hey, I think it's time you hang up your white coat, you hang up your stethoscope, like it's time for you to go relax in retirement.
Like I said before, I think the key phrase that Dr. Townsend said was,
I don't have enough energy for this anymore.
And that translates to unsafe patient care, honestly. And I think recognizing when it's your time and saying it yourself can probably be a little bit more powerful and empowering than when someone else has to tell you that it's time to hang up the white coat and the stethoscope. Obviously, I'm not quite at retirement time, so I can't tell you how that feels, but I can tell you that most doctors have a really, really tough work ethic, and we probably all want to be working forever because it's hard to just sit around and do nothing. Hello, I'm on YouTube on my days off because I just don't want to sit around and do nothing. And so finding a hobby is one way to spend your time, and Dr. Townsend probably is at the point where he should find a really great hobby and pour himself into that. So tell me down below what you guys thought of this episode. If there are any other episodes you would like me to react to, I am happy to do so. This episode was actually requested by a subscriber, so thank you very much for that. Leave a like down below, subscribe to the channel. It really helps the girl out. Thank you so much for joining me. I'm Jess the MD. I really enjoyed spending time with you. I hope you enjoyed spending time with me, and I will see you in the next one.